We are live. Hi, I'm Dr. Rob Silverman, Amazon bestselling author of Inside Out Health. I'm here with ex-professional football player, if I may say, great guy, one of the smartest guys, a good man, Mr. Asher Allen. How are you today?
Doing good, my man. I'm always happy to spend time with you, and definitely looking forward to talking and really talking about a topic that needs to be talked about. But doing well. It's a Friday. The weather is a little gloomy down here in the southeast, but definitely happy to be here.
I'm happy to have you. And so everybody knows we may be smiling through the whole 45 minutes because we have a rhetoric. We really enjoy our company. And this topic is very unique to both of us because we believe that athletes are very different in that they need some different treatments, and parents who have athletes also need to know what to look for. So let me tell everybody a little bit about you, those who don't know you. You're an Atlanta native. You attended the University of Georgia, and you had the honor of being on the all-decade football team. You were drafted by the Minnesota Vikings in the third round of the NFL draft. You are also a certified professional trainer with additional certifications as a weight loss specialist, corrective exercise specialist, performance enhanced specialist, CrossFit level 1 trainer, and a metabolic analytics practitioner through Strength Sensei. Right now, this is how we really know you, is you're a functional medicine consultant for Nutridyne, a company that I work for, as well as you. And you help practitioners implement strategies for effective patient outcomes at the crux of individualizing it and personalizing it for patient outcomes. So again, happy to have you. What's going on, man?
Hey, man, not too much. Excited to be here. We, like you mentioned, man, we spend a lot of time traveling together and being able to educate the world when it comes to functional medicine, integrative medicine. So just another notch on our belt. I'm definitely looking forward to it.
So I am too. I'm happy you're here. So let me ask you the big question. As an ex-football player, I know there are things that you have to be cautious. Everybody always says football players, concussion because of it. So why don't we delve right in and
Sure.
Let's talk about concussion. Let's talk about some treatments. Let's talk about some of the misconceptions of concussion. And maybe we'll give everybody a little concussion protocol, something to work on for the high school athlete.
Sure. Well, first of all, my comments that I'm going to be giving during our conversation is just reflecting my many years of organized sports and my colleagues and the circles that I've been with. So in no way it doesn't reflect my personal experience with one organization, but it's really just a combination of experiences throughout many years. So let's just dive into it. Yeah, when it comes to concussions, what's interesting in the sport that I was accustomed to, football, let's really first dive in. What is a concussion? Rob, let's right now what they call a concussion, we call that a shoulder tap growing up. That was a shoulder tap, a concussion was being knocked out. That was a concussion. So through park ball, high school, college, NFL, really a concussion is getting knocked out. That's what's communicated to us as athletes. But now, a concussion is any type of trauma to the head and neck area, and we thoroughly understand that now. So what's important, I think, just from an athlete's perspective, is understanding what a concussion is, because to be honest with you, we have a concussion every day by the definition now that's out there of a concussion, because we practice harder than we play. What you all see on TV is really a reflection of what we do Monday through Friday. So one of the things that's really important is understanding what a concussion is. Again, seeing 3 people is not normal. The same person, and often growing up, what you're told is that if you see 3 people, hit the middle person. That's the world we live in. If you're seeing different colors, pick one and choose it. These are how we're communicated to in our circles. And so understand that those are concussion symptoms that can lead to other things long term. So understanding what a concussion is and needing to be able to talk to your trainer, being able to talk, and again, if we're talking to a parent, being able to see that with your kid, if they're being told that, hey, you're having some symptoms, definitely take it serious. And for many years, the treatment for concussion was, okay, you got your bell rung. You were knocked out for a little bit, but you came back to. We're going to put you in a dark room, cover your eyes with a wet towel, and then just kind of shake it off. We'll see you tomorrow.
Mm.
That's pretty much the treatment. And then the days afterwards, they put you through an exercise routine. And if you throw up multiple times, if you can't stay up, well, then they'll continue to work with you until you're not throwing up as much or you're not walking as in limbo, and then they'll return you back to play. So really, when we think about it, understanding what a concussion is, and then when it comes to treatment now, we understand that that's really not the case. We actually want to increase BDNF. We actually want to increase movement. We actually want to do things, which is really an opposite of a lot of the things. But again, understanding functional medicine like you do, these are the kind of conversations that we're going to understand.
Yeah, absolutely. What is a concussion? So everybody knows, to piggyback on what you said, most people think it's the impact, but we both know it's the shearing. It's the shearing of the axons. Those axons are communicators in the brain. They get damaged. And you're right, probably what you did as a football player, or what people do in all sports, even basketball or any kind, rugby, lacrosse, they bounce their head back and forth. So that's why you see so many athletes now trying to strengthen their neck. You refer to the idea of BDNF, right? And exercise. So great takeaway there. Parents, write this down. That rest doesn't work because you want to get that athlete up and moving. You just want to get them in a steady state, not moving their head too much. And BDNF, brain-derived neurotrophic factors, that excites me because it proves that your brain can grow the neurons back. So if your nerves fire together, they will then work together. So BDNF, that's gut. We're not going to go down that. I'm not going to hit you with all the gut.
It's important. It's important though, Rob, but we won't go there. But
it is.
Yeah, that's definitely important.
BDNF, brain-derived neurotrophic factors. So let me ask you some things that we really wanted to go over. Let's go over a little bit of a concussion protocol. So when I say concussion protocol, we agree. Some exercise, steady state. Some good quality, chiropractic treatment. From the functional medicine side,
sure.
What do you think that these athletes and these parents should be looking for from the doctor?
Well, there's a direct connection between our brain and our gut. And again, there's a disconnect really amongst practitioners. We're really just learning this information, and you're really championing and pioneering the movement of what you do to your brain, you do to your gut, and what you do to your gut, you do to your brain. And so understanding that, it's not uncommon for athletes after they have a concussion to have diarrhea for weeks. It's not uncommon for those who have concussions to not be hungry, don't want to eat. Their appetite goes away. And then also, obviously, throwing up and other things like that. And so really, when it comes to a protocol, first thing that we want to do is reduce inflammation. That goes without saying. We obviously introduced trauma to the head and neck area. We want to reduce inflammation. One of the best things that we can do that's really a nice entryway into functional medicine, understanding that food is medicine, is really omega-3s. Omega-3s contain a component that's called EPA. EPA will help to reduce inflammation. And that's what we want to do. We want to put a hose on the fire. The house is on fire. We don't want to just look at it. We want to put the hose on the house and make sure that the fire goes down. After that, we need to rebuild. What are we going to rebuild with? Well, what was in the house beforehand. We want to use similar things that were in the house beforehand. So we want to use some high quality proteins. But most importantly, there is research that has come out of Harvard in the last few years that helps us to see there's things called pro-resolving mediators that can come from omega-3s. But unfortunately, our bodies don't do a good job of doing it. So another thing that we would recommend for parents to look into and practitioners are things called pro-resolving mediators. These downstream metabolites of EPA and DHA help to encourage the resolution phase of inflammation. So it's not enough just to put the water on the water hose on the fire. We actually want to rebuild the home and start getting furniture back in the house. And that's what PRMs do. They get us back to how we were before the injury. And if we just start there, and again, we can go so deep, we can talk about bromelain, we can talk about other things that are helping with inflammation. We can talk about things that help to bind the gut, whatever the case may be. And we'll talk about that when I recommend 3 products. But really, for something that, if you're a mom with 5 boys and they're all on teams, all the way up to a professional trainer, we can understand omega-3s. If every patient of yours, every client was on omega-3s continually, we would definitely do great with our concussions.
Absolutely. So the omega-3s are great. They're a great choice. Good for cell membrane. Just to take it to the next step. And there's some data on omega-3s that actually say it's great to help prevent the concussion. So to speak to what you're talking about, we're going to get in a little prevention, I'm sure, when you talk about the athlete and what you have to do. Omega-3s, pro-resolving mediators. Now I'm going to try and temper my enthusiasm. With Dr. Charles Serhan from Harvard. You're right. They resolve inflammation, but they've shown to create the micro environment in the brain to allow for anti-inflammation. And the biggest issue that at post-concussion, people will say, well, I'm okay, I feel all right, but they don't realize that shaking, that damage, that pivot, that shear leads you down a path of releasing inflammation. And there's nothing better than PRMs. And believe it or not, PRMs, and I'm trying not to get too heady, stop what we call the body from attacking itself. And we know that the bulk of damage in the brain, if we go to the next one, and we're lighting up now that we're talking about it, because I can see everybody's coming in. Yeah. PRMs, stop your body from attacking itself, or at the very least, turn that volume down. It's a great call.
And again, if you're watching this, you're going to say, why haven't I heard about this? That's why it's so important. If you're a patient, if you're a parent, or if you're an athletic trainer that's responsible for a whole team and their nutrition, or you're the RD on the team, it's important to, in your local community, find a functional medicine practitioner and learn this. You're dealing with lives of individuals that you can really benefit with simple interventions.
You know what? Just before we get into a couple of questions that I have waiting for you, you've used the term functional medicine a couple of times. What kind of doctor is that?
Well, I love it, and I didn't make this up, but functional medicine is the opposite of dysfunctional medicine. That's what it is. Dysfunctional medicine is a pill for a nail, really not looking at the root cause of an issue. A functional medicine practitioner, don't go there with only 10 minutes. Because that's just going to be the introductory. We want to understand why you feel this way. If you're walking around with a rock in your shoe, we're not going to just give you an NSAID to deal with the pain. We're going to talk about, why is the rock there? How can we get the rock out of your shoe? And how can we prevent that rock from getting in again? A whole different conversation. This is the conversation people want. This is the conversation that people want to pay for. So functional medicine is really the idea of healing someone from the inside out, from the outside in. Our body really either has too much of something or not enough of something. And a functional medicine doctor is trained to figure out what that is.
Absolutely. I love the idea of root cause resolution. Symptoms is what too many doctors are pointed at. Systems are exactly what we need to analyze. And within the systems, that root cause resolution is the choice. And it's all about communication. But since we're talking about communication, sure, I want to dial it back a little.
Okay.
How is it an athletic patient different than a regular patient? So you being an athlete, and doctors see these patients and they just don't understand that athlete's mindset is a little different than the regular person's mindset.
That's a good question. Yeah, because I work with practitioners, so we talk about lay personnel and how to work with them. But I would say the biggest thing is understand that if you are looking to expand your practice to reach out to more athletes, you want more healthy people, you want more A-type personalities, you want the D1 college athlete when he's in an off season, or you're a practitioner who works with an NFL team or a professional team. One thing you got to understand is that patient is highly motivated. We wake up at 4 a.m. running hills. No one asks us to do that. We do things differently because we're goal oriented. So the first thing that I would say is just understand who you're speaking to. You're speaking to someone who, first of all, if he's at your office or if he's talking to you, he's already done his research. We understand that our bodies are our money makers. Our bodies are what's going to help us take care of our families. So we've already reached out to you. We know who you are. So don't try to sell. There's no need to do that. But understand that we're highly, highly motivated. So when you speak to us, saying that I can get your IL-6s and I can get your certain biomarkers down doesn't mean anything. I'll be frank. It doesn't mean a thing. But if you tell me I can get you out of the training room and back on the field, okay, that's why I'm here. What do I need to do? Well, we're going to have you on, 6 to 8 grams of EPA DHA. We're going to have you on D3. We're going to have you on some other anti-inflammatories. We're going to heal your gut. Why am I doing all of this? This is going to get you back on the field quicker than if you didn't. So just understand, get in their cleats, put their helmet on, put on their shoulder pads, think like an athlete. And if you do that, you'll be able to grow that part of your business. But then also you're going to really be able to speak to an athletic person. And again, we're not just talking about athletes. We can talk about people who are on the weekend or just really have that athletic mindset and they work out. We want to be goal driven. And then after that, you don't have to worry about it. We're going to do what we're supposed to do. Again, we wake up 4 a.m. and we run sprints because we're goal driven. Help them to see how what you're doing, these ideas that may be new to them, how they're going to help them on the field perform better.
Excellent. So goal driven. They want results.
Yeah, that's it, man. We don't tell me, hey, we're trying to get certain ratios better, or we want to get your D3 levels up because is this going to make me better than the guy across the ball from me? Yes, that's the language we speak.
I remember a couple of movies about athletes. So it was Friday Night Lights, and I think his name was Boogie, and he had a knee injury, right?
Yeah.
And he's like, when can Boogie dance? Like, okay, that all sounds, can I play today? And that's all he could comprehend. Even Kevin Costner playing, I think it's he pitched a perfect game.
Oh, yeah.
I get, and he was a Detroit Tiger and he had this bad injury. And, he just lit up his trainer because his trainer's like, well, maybe what you think you're going to get to, you're not going to get to. And he said, if you ever say that to me again, don't talk to me and you're fired. Yeah. And most patients are like, I don't want to work too hard. I want you to do it. The athlete's like, I told you I had this guy come in and he came in and, he's 20 years after being team captain of a very reputable college. And he walked in and he said, where's your A game? I'm ready. That's what I'm used to. Mm-hmm. So it is a different setup. So much so, I think that most people assume that athletes have this great immune system. And you're an outdoor athlete. When you think about it, you're outdoor in football, unless you played in a dome or something like that. But essentially, football's played outside. You're a track. So obviously, there's indoor and outdoor track. So athletes are exposed to things. So one thing I think that people don't look enough at is the athlete's immune system. And I'll let you take tackle this one. Also, where the athlete's nutritional competency and where are they getting their information from or misinformation?
Yeah, good insight. Well, and again, I think that many are well-meaning, and again, we can only share what we've learned. The idea of nutrition to an athlete is really at its infant stages. But I will tell you this, there's some SEC universities that I've been to that I've seen, and I tell you, their nutritionists, their registered dietitians have done an excellent job. They're teaching the kids how to eat. They're teaching them macros, micros. They're teaching them gluten, how to avoid it. They're doing certain things that is a great step forward. Is it where me and you understand they could be at? No, not at all. But they are doing some good things. But as a whole, a nutrition is really something that as an athlete, you have to go out on your own and find out. Inside organizations, you're not going to learn a lot about nutrition. Again, think about it from their mindset. I'm not going to say Dr. Rob Silverman, we draft you. You sign a 3 to 4 year contract. After that, we don't know what we're going to do with you. You're going to invest that kind of time in you for those 3 to 4 years, or are we going to use interventions that get me the best results, the quickest, that may have really, really bad side effects, but I'm going to have Rob on the field for 3 to 4 years. And then when he's done, we may have to just kind of throw him to the side. I'm alluding to the use of drugs over nutrition, not letting food really be their medicine. So when you see an athlete, especially if they're professional D1, their understanding of nutrition is not really at the point where you're going to want to be them, where you want them to be at. So you're going to have to educate them. They're going to come from a world where I have a torn labrum. I have a grade 4 separation. Are you telling them that we need to rebuild with collagen? We need to reduce inflammation. This is going to be a process that won't resonate with them because all they know is cortisone shots and Toradol. That's all they know. And they know that, yeah, I hear you, but we're going to have to go ahead and I got to get back on the field. So again, unfortunately, understanding nutrition, understanding functional medicine, understanding the time that it takes to do that is not there. And when it comes to food, it's not uncommon for people to chug a big Pizza Hut, pizza right before a game. And because youth is on their side, they really won't see the side effects. But unfortunately, again, we want to get the greatest potential out of our athletes, and we're simply not doing that. So really the state of nutrition and athletics is really at its infant stages.
I am answering the question. So if I lean forward, don't think I can't hear you.
Sure.
There's somebody who just said, I hope this is recorded because this is absolute gold. So everybody knows it is. We have it running on Facebook. We have the podcast, Proven Health Alternatives. Okay. We also have it on my LinkedIn. We have it on Asher's LinkedIn. And we also have it running on Nutridyne. So take your pick. We've got it on a plethora of different platforms. And I just put out, feel free to ask him a question. It's all about give and take. So I'm going to skip around a little bit. We've talked about functional medicine. So I'm coming in, I'm bringing my nephew in. He's a 15-year-old, 16-year-old athlete. What functional tests or diagnostic tests would you recommend that we take?
Excellent. Well,
and hold on one second. Lola, I apologize. I will ask him that question after this one. So we have a couple of incoming questions for you, but
sure.
Please. Terrific.
So again, just using the context you provided, right? So 15, 16-year-old, I have a son. He has great talent, and I really want him to go D1 and even further. Well, there's going to be some things that we know now that back in the day we didn't do. But if we, as a parent or as a guardian, if we can tap into this now, wow, what amazing things we can do. First thing that I would say is a food sensitivity test. What does this have to do with sports? I'm an athlete. I score touchdowns. You want to see if I'm allergic to gluten? Again, that's where the disconnect is that I now understand. And again, when I was in that world, I didn't understand. I didn't care. How can I run faster, be stronger, and jump higher? That's all I care about. Gluten, what are you talking about? But understanding now that, what if you understood that your child was sensitive to gluten and that every time he has a sandwich that's full of it, genetically modified gluten, that his body goes through an attack on himself, which now is festering and triggering him to other diseases that attack other objects like joint cartilage, like his digestive tract and the microvilli in there that's responsible for absorbing the nutrients that he's eating. Well, guess how that may be manifested? Oh, he's always hurt. He's always in pain. You know what, coach? I don't think we can have him on the team. He's the term that we use in the locker room. He has the injury bug. Stay away from him. He's got the injury bug. What if it's as simple as that he is sensitive to gluten? And every time he gets gluten, his body goes to an autoimmune reaction and he can't perform. So now we have an athlete who is amazing, but he has no idea that his body is working upstream against his diet. So first thing, let's do food sensitivities. It's tough enough to be a Division I athlete and a professional athlete. Let's not hurt ourselves. I mean, it's enough that the guy across from me is great, but I'm going to also be damaging myself through what I eat. So first thing I would do is a food sensitivity test. Next thing I would do, again, we have the amazing world of genetics where we can learn more about our children. Again, I'm going to stay in the context of your question. A 15-year-old, 16-year-old, what if we knew that that individual was predisposed to disc injuries? how would that change the way I train my child or who I allow to train him? Would he be doing ballistic type exercises? Would he be doing heavy extreme lifting? That may affect how you feel. What if you found out that he has certain genes like the ACE2 gene? That means that endurance is really his specialty. He can do really well. He can execute very high levels of endurance performance. But we have him doing shuttle drills and sprints. We're not tapping into what he's really good at so that he can perform the best. So with genetics, I can understand as a personal trainer in that background, I know exactly what to do with this person for him to reach his genetic potential and not take a cookie cutter approach and put them all and have everybody doing power cleans, right? That's kind of an old school mindset. So we're saying some radical stuff here today, Rob. This is radical, right? Hold on, what do you mean? We all do power cleans, we all do Olympic lifts, and we all sprint until you can't feel your legs. That's training. Well, it's 2021, and we have some extra tools that if used, we can take it to the next level. So those are two tests. In addition to that, in omega-3, we talked about a little bit about that. And again, this is very elementary, but an omega-3 test, and we can provide more information on that. But again, we know that certain ratios like omega-3s to 6 can help you to see an individual's inflammatory state inside. And again, if you're inflamed, if you're constantly in pain, you're not performing. So an omega-3 test, that we can take a look at it, and then we can use certain interventions through supplementation or diet, or we can also omit certain things from his diet so that we're not increasing the inflammatory state of his body. And then lastly, I would say a D3 test. A D3 test, there's only about 3 substances in our body in which there's a receptor on every single cell. What that means is that when God made us, he said, these substances are really important and every single cell part of your body needs it. And one of it is D3. And so D3, there's a direct connection between risk of soft tissue injuries, sleep, bone fractures, and your D3 levels. So if your D3 levels are low, you're going to be more prone to things that are going to keep you off the field. And I'm sorry to tell, what we're accustomed to hearing. We're D1 athletes, but we have bowls of Frosted Flakes, and that's how we get our D. Vitamin D is through Frosted Flakes and hormone-filled milk. And we say, I just wonder why these guys just can't stay out the training room. It's really something that I'm passionate about. And but again, those tests, I would look at the food sensitivities, I would look at genetics, I would look at their omega-3s, and I would look at their D3s, just as a basic panel of ideas to get testing, just so that my child, my team can perform.
Well, I got a lot to unpack. That was a hearty answer.
Amen.
So number one, I agree with you on food sensitivities. Food sensitivity, again, they're hidden because the symptomology comes out 72 hours after. Food allergy, you eat it, you swell, right away. And people just don't understand, because if it's not here and now, they don't understand that 72-hour length of time. Gluten sensitivity. 4 out of 10 Americans have gluten sensitivities. What's most interesting is, yes, you get all this extremity injury, but gluten directly works with the cerebellum in your brain because it has the same protein sequence. So people don't realize, they say you're not thinking straight, get off the gluten. I agree with you on the omega-3 to omega-6. It's an easy test. It's one that anybody can carry in their office. It's an easy marker for overall health. Again, concussion health, brain health, and vitamin D3. We should call it hormone D. Without question. So for all my chiros and my functional medicine people, if you haven't started, give them some D3 because it's going to work right away. It's great for immune health, great for musculoskeletal health. What I am going to do is, because we have some questions and I want to encourage it,
sure,
I'm going to show it. So you should be able to see it.
Let's see if I can see the questions. You know what? I can have you say them if that's okay.
Yeah, I'll have it. He can't see it, but I can. That's fine. So we got Lola Gold. She said, please share with us how to restore collagen.
Oh, sure. Sure. So collagen, I love it. It's the most abundant protein in our body. So again, what do we learn? We need it. Collagen means glue. It keeps us together. So we need it. Unfortunately, in our diet in the West, we avoid foods with collagen. As simple as that. I have a practitioner here in the Atlanta area, and we have a formula that's called Dynamic Collagen Renew that helps to restore collagen. But she says, I don't need it. I said, why? She said, oh, in my culture, we eat soup, but we eat the eyeball, we eat the skin, we eat bones, we eat organ meats, we eat all of that, and it's all in the soup. I said, wow. Yeah, we really are. In our culture, everything's skinless, boneless. And if you look at the drumstick afterwards, it's still got cartilage on it. There's still connective tissue on it. But in Eastern cultures, we take a look at them, our Asian friends, whatever the case may be, we look at them and they'll tell you they're 80 years old and you'll think they're 60 because of their collagen-rich foods that they eat. So first of all, we always want to do things through food if we can. So how do we restore collagen? Eat collagen-rich foods. Foods that are high in vitamin C. Vitamin C helps with collagen synthesis. So our citrus, our brassica families. Also, what we want to do is, again, eat things that are high in proline. Proline is one of our components of collagen. So egg yolks, organ meats, all types of meats as well. So really eat the things in which that you want. So if you want collagen, you have to eat collagen as mammals. And that was the first question I heard.
Right. Yeah. Collagen, great for skin, promotes healthy nails, supports the joints, bones, ligaments, and tendons. And let's not forget, collagen also helps with gut health. So collagen 1 and 3, skin, hair, nails, gut. Collagen 2, cartilage. 5, 10, and 15, to speak to your formula, all about tendons. Second question, what nutritional tips do you have for middle-aged Americans who are weekend warriors? They're speaking about me, my man.
Yeah, no, and excellent. And well, first thing I'll say is do not lose that spirit. We all are athletes. We just have to tap into it. So don't lose that spirit. Tip would be, what we have the tendency to do is overdo it. One thing that people don't understand about athletes is that we work really, really hard, but we recover harder. So that's the thing that as a weekend warrior, you may not have certain things available to you, like ice tubs and electrical stimulation and ultrasound machines and just these different modalities that we use regularly that allow us to recover. So what I'm saying is this: you're going to be working hard on the weekend, but be sure to recover just as well as hard as you work out, because that's what we do. Sauna, ice, stretch, chiropractic work. We do all of that, but you don't see that. You see us lifting, 315, 18 times. We're doing a lot of recovery. So make sure that you're taking your recovery, because that's really where the growth and the performance comes. So be sure to recover as well.
So we've got another question. It's really good. It's essential amino acids or whey or collagen?
All of them. That's if you don't have a sensitivity to casein, why not? There's a lot of benefits for whey protein if it's grass fed and not hormone treated. We're not against that. We have a formula called Dynamic Whey that's from New Zealand cows that are grass fed, and it's great for your immunoglobulins. It helps to increase that as well. So there's tons of benefits for whey if you're not sensitive to it. Essential amino acids as well. Obviously, we want to get that through food, but these are the building blocks, and we want to make sure that we have that. And then also with collagen. Collagen now has become a part of my daily routine. So we have a product called Collagen Renew. Again, it's unflavored. I can add it to my foods to make my broths a little bit thicker and rich in collagen, or I can just add it to my protein shake that I take every single morning that has fruits and vegetables in it and the like. So all of those are important. I would just look at your sensitivities, because again, we don't want to shoot ourselves in the foot. It's already tough enough in this system to be healthy. So don't just shoot yourself in the foot by eating things that you're sensitive to.
I'm going to add one too. We didn't talk about it. Pea protein.
Sure.
So are you good with the pea protein as an athlete? I had guys come in my age, will post 50 and they go, you got to eat meat to get big.
Oh, no. Look at gorillas. So they just, they're eating tons of it, right? So it's all about the quantity for them. But again, but if you have a lectin allergy, again, I'm all about the allergies. But if you're not allergic to it, if you know that because you've done a lab test with Dr. Silverman, or you've done it with one of your functional medicine doctors, then yeah, It's okay. And we have many formulas that have a pea protein in it, pea and rice protein in it, and that do really, really well for many of our athletes. So nothing against that. But again, it's all about the allergies. It's all about your sensitivities. That's something that we have to be mindful of.
Yeah, my wife just said she loves the collagen in the coffee in the morning. And the thing that I do like about the collagen is its versatility and flexibility. You can't see it, but I'm punching the questions up. So if anybody asks a question, it comes up. Everybody sees the question when you're answering. We got another one. And this is something that you and I wanted to talk about. So here it is.
Okay.
Top 5 supplements for optimum health for an athlete.
Okay. So, I can see the question now. So you can keep those questions up so I can just kind of read from I just kind of made my screen a little bit bigger. Sorry about that. Okay. So top 5 supplements for optimal health. Okay. So top 5 would be the following. D3. We talked about that. Omega 3s.
Whoa, I'm going to stop you. We're going to dial back. D3 and K2.
D3 and K2. Yep. We're just so accustomed just to understanding that. But yeah, D3 with K2.
How much?
5,000 to 10,000. 5,000 to 10,000 IUs. 5,000 is a safe bet. But if you're actively doing your 25 hydroxy test, then you can, just to get to that upper third with your lab values, you can take whatever you need. But I personally take 10,000. That's because I'm actively testing. But 5,000 for everyone who may not be doing that. So D3 with K2, again, K2, which was called vitamin X for many years because no one really understood what it was. But K2 is so beneficial. It makes sure that it goes where it's supposed to go. So we said D3, omega 3. Again, we talked about that. After that, some type of phytochemical blend, something that has organic, non-GMO superfoods. Again, the reason why we are told to taste the rainbow, not literally with that product, but we really want to taste the rainbow because all of these different colors that we see in nature have benefits for us. So some type of superfood. We have a product called Nutridyne Fruits and Greens, 40 different organic, non-GMO superfoods all put together, and they taste amazing. After that, we would recommend a multivitamin just to take care of your micronutrient status. We know that a deficiency in any one of them can have really, really, really bad effects. So we want to make sure that we have a high quality multivitamin, and even better if it also has plant extracts as well. And then lastly, a probiotic. Again, what you do to your gut, you do to your brain. What you do to your brain, you do to your gut. And what we understand is that the gut is the epicenter of our health. So you have to take care of your gut. And back in the day, we weren't as sterile as we are now. We went outside, we farmed, we put our hands in the dirt, we touched our face because we were sweating, and we got all of that good bacteria into our bodies. But now we're indoors and we're in rooms with Zoom. And so we definitely want to make sure that we are putting probiotics into our bodies at adequate levels. So again, the 5 would be vitamin D. We want an omega 3. We want a superfood. We want a multi, and then we want a probiotic. That's just your basic. That's your foundation. That's your Fab 5, so to say.
Exactly. Excellent. Now, within the omega 3s, a lot of people always ask me how much and what form. Acetyl triglyceride. That kind of thing. Liquid, soft gel.
Yep. So I prefer liquid. So from a practitioner standpoint, it's all about your patients. You know what they can process. If they, don't like to swallow, if they don't like to, do whatever the case may be, we can have the liquid. As far as the form, triglycerides or ethyl ester or EE, we understand that once it hits the small intestine, we understand that both are processed very, very similar. So don't really get caught up in that as per the research. But again, whatever is available, make sure that it's of high quality. That's the thing about it. Not all omega 3s are created equal. Omega 3s, unfortunately, we know that toxins are fat soluble, and omega 3s are fats. So they are a hub for toxins. You want to make sure that they're testing for dioxins, PCPs, all types of things. We want clean, high quality, sourced from very clean waters, which Nutridyne has. And again, my favorite is about 2 to 4 grams. 2 to 4 grams of EPA DHA. That's really a nice foundation for that. And then I saw that question. Yep. So top 5 for athletes. So again, this is going to speak towards our genetics. Gone are the days where we just say, everyone take this, right? There's some things that we can say that. But when it comes to sports performance, what I would like the conversation or the question to be is, hey, Asher, based off of my genetics, what should I take? Now we're cooking with gas. Now we're acting like athletes. We don't put on any cleats. We don't put on any type of gloves. We want the best. We want to make sure that whatever we're having is the best. And so that's what I would recommend. Do a genetic test, and then based off of your genetics, you would know what supplements you need. But simply put, I would recommend a collagen formula. If we're looking for sports performance, obviously we have to address our energy system. So something that can help to increase our ATP, take care of the health of our mitochondria. So something like carnitine, huge fan of carnitine, love it, love it, love it. Creatine, obviously, beforehand, that's something that can be taken. But any type of vasodilator just to help increase blood flow. So whether it's citrulline or arginine, all of that is really, really important. And then obviously for recovery, we want to make sure that we're increasing our protein intake. Again, 1.5 kilogram per body weight. If you're inflamed or actively working out, we would recommend that. And then obviously with some physical medicine like chiropractic work, myofascial, whatever the case may be. So for performance, I would like the question to be, hey, Asher, based off of my genetics, what should I be taking? Because really we can answer that question specifically for you, which we have the capability of doing now.
And the genetics are a great starting point, because when you get your gene pool, everybody needs to know genes are not your destiny. They're only 10 to 30%. It's all about your environment. But knowing where you are, so for instance, people can test if they're fast and slow twitch fibers. Obviously, if you want to be a sprinter, you need some fast twitch fibers. If you're a different athlete in a long distance run, you would want to be slow twitch. But somebody just texted me and asked a great question. When did you know, because you were a professional athlete, when did you know what, I'm pretty good at sports? And what can they do to test their son or daughter to understand if they're really that good? They don't want to be that dad that says, oh, my kid is just great. I didn't even make my high school team, but he's good. I mean, you've heard that one before.
Yep. You gotta throw them in the fire. You gotta throw them in the deep end. No one gets good. You didn't become who you are, Dr. Silverman, by being timid and hiding behind a computer. You had to get out in front of people and do what you do. Same thing. You'll know your kid has the goods. Put them in the camps. Put them with the top athletes. Don't be scared and say, well, he's 10 times his size or he's faster. That's what you want. And you'll see instantly whether to that Goliath, he'll either back down or he'll stand up to them. So how I knew was, thankfully, where I'm from in the Atlanta area, it's really bred from when you're born, you're doing sports. That's kind of the attitude. So my circles, we were very competitive. And so at a young age, you just kind of realize that, hey, you know what? A lot of people are trying really, really hard. It's a little easier for myself to do some of the things that they're doing. That was one thing. And then obviously competing against the best and succeeding, that's how you realize, hey, I think I can really do this. So my encouragement would be, there's camps everywhere. There's Nike camps. There's local camps. Put them with the big boys. Put them with the big dogs and let them fight.
So you're going to laugh. I need you to just take a look. Here's one. And don't answer it just yet.
Okay.
That's actually a chiropractic classmate. So he is bound to secrecy. Like in the league, you're bound to secrecy in the locker room. That guy's bound to rob secrecy. Yeah. Because he spent 4 years with me, and he could probably Bill. So that's one question.
Yeah.
That's that question. So they're essentially the same question.
Yep. So, Bill, I'm sorry that you spent time with Rob for 4 years. It's just, hey, we all got to go through it. I hope
you're better for it. It was
So the best genetic test, in my opinion, is the genetic test that Rob uses, that our practitioners at Nutridyne use. We partnered with 3x4 Genetics. 3x4 Genetics is based out of South Africa, and they are really bringing some really exciting information about genetics. And so, Bill, as a healthcare practitioner, you will avail yourself. That's not available to lay personnel, but for you, you are able to have those tests done for yourself, and then you can prescribe those to your patients. So it's called 3x4 Genetics. And if you go to Nutridyne.com, you can see on the front page, you actually see a nice little emblem for them, and then you can get more information. But you're a friend of Rob, so you're a friend of mine. So feel free to contact me, and I can get you more information. Now, what is the best genetic test? And again, in the context of what we're going over with, I would recommend there is a performance panel that 3x4 does, where they look at your endurance, they look at your training response, they look at your power ability, your injury risk, your recovery. All of that information is all provided in a very colorful, self-explanatory panel that your practitioner will go over with you. But that test, I would recommend in the context of what we're talking about as far as athletics.
Got another one for you.
Okay. Full blood work. And
yeah, let me read it out. Full blood work, anything specific, HMB, hemoglobin A1C, RBC, magnesium, RBC, zinc, folate, B12, C-reactive protein, and cortisol. So they're asking,
sure,
what would you do in a full blood work?
Yeah, all of those. Yeah, all of those. All of those are very, very important to a muscular, but also cognitive health. So I would definitely recommend all of that. One of the things that I'm happy that you brought up was cortisol. Extremely important. We know that athletics is a high stress event, right? Running full speed to a grown man is a high stress situation. So cortisol levels, we want to take a look at that. And again, I go back to genetics, and I'm sorry, but there's certain genes that we can see. How do people process catecholamines? Are they fast? Are they slow? We can really see how to train according to that. If you can go back to the question, I can see the other panels. I definitely hemoglobin A1C. Your athletes. Now, type 1 diabetes is actually a little bit more common among professional athletes, but again, we understand that to be more predisposed. But as far as hemoglobin A1C, that is something that for your athletes, I don't see that as much of a concern because of the fact that their exercise is so intense that they're really getting that glucose into the cell and it's being utilized. We don't see too much type 2 diabetes or pre-diabetes, even with our big fellas. So our O linemen and things like that, we don't see that. But after they retire, we see a lot of that. We see a lot of cardiovascular health. So all of that is excellent. It can help you to see where you need to fill in the gaps. Excellent panel. But again, before we get to that, I'm going to keep saying it because it's so exciting. And with the patients that I've worked with that, I love it. So let's see.
Viome or Leap MRT.
You know what, Rob? I'm gonna let you take that. I'm not familiar with that.
What? Can you look up I'm going to be straight. I got to look up the Leap MRT, but Viome. So essentially, these are gut tests. They're looking for what's going on in your ecosystem.
Sure.
And I got some comments that I didn't put up on questions on the probiotics. So it's very interesting because it gets back to something that we talked about. That most people take for granted that athletes don't get sick. And what we saw, to use as a metaphor and as an example, when the basketball players who are great athletes and young and healthy, when they're in the bubble, nobody got sick. But when they went in a regular population, they got sick because athletes can have a compromised immune system. But the key component is, was there any day that you worked out and played football that you didn't exercise less than 2 hours? So exercise over 2 hours damages the tight junctions.
Yeah.
And that damage to tight junctions allows for leaky gut. You're down this slippery slope. And of course, if you have a tight junction problem, zinc carnosine is a great choice, as well as liposomal glutathione. So we're not sure the best gut test for ecosystem we think that they're better. At least I'll say I think there are better ones coming out. But I like barrier systems to see, and I like that food sensitivity and the panels, inflammatory panels that we talked about a little bit. Did you get that info? So LEAP stands for Lifestyle, Eating, and Performance. The LEAP program uses a blood analysis test called the mediator release to identify trigger foods. So again, trigger foods, allergies, and everything like that. So you learn everything on these things. That's great.
I'm a big fan of that because I can't tell you how many in our locker rooms, there's so many athletes that I look back retrospectively now and I say, this guy was amazing in college. This guy was amazing when I first saw him. But you look at his diet now, you wonder, his inability to perform in the fourth quarter, his inability to focus, his inability to, he got beat for a play and he can't come back down to equilibrium and start to perform again. How much of that is genetic? How much of that is him hurting himself versus just an inability? We kind of say that he's not cut out for this. Well, maybe he would if we could put him in a situation where he's taking care of his health better, avoiding sensitivities, and we're helping him reach his genetic potential. So it's a conversation that I think in sports world we're kind of macho, and that these conversations seem kind of secondary. But if we can put it to the forefront like we're doing today, I just think our athletes are going to have longer careers, better careers, and then most importantly, after they're done, healthier lives.
So going back to the beginning, is it possible to have a concussion protocol, please? So
Sure.
Let's do the top 5. Let's talk. All right. So I'll let you do the products. And here's what I'll tell you. Good chiropractic treatment, musculoskeletal, pointed at COC1 upper area. Number 2, proprioception, balance in space. Number 3, gaze stabilization. Number 4, for me, low-level lasers, really been shown to help with the release of BDNF, shown to also help with the microenvironment. Asher, you give me your 5 nutrients that you like for post-concussion rehab.
Okay, cool. Yeah. So one of the things that I really like is during the first 24 hours or 48 hours, I really like addressing some of the immediate acute inflammation. So one of the first things that we're going to want to do is just get some of those powerful anti-inflammatories in there. And things also that I know you often speak about is the MMPs, making sure that we get those under control. And so there's certain formulas that we have at Nutridyne that we can make sure that we have that. So again, the principles, right? The principle is that we want to lower the inflammation. And then after that, one of the things that we're going to want to do is introduce a formula that I like, which is called Dynamic Brain Restore Powder. So Dynamic Brain Restore powder, it helps with the dendritic lengthening, and then also helps with brain cell communication. So that's one of the things that's an underneath factor that we really want to address. And it also has one of my favorites, L-carnitine, which can pass the blood-brain barrier, and it helps with neurotransmitter support. So one of the things that I like, again, let's lower inflammation. We talked about omega-3s. Dynamic Brain Restore powder, we really like. It has the acetyl L-carnitine in it. And then it also has other nutrients that can help with cell signaling. We talked about omega-3. Now, brain support is a formula of ours that we have. When I think about it, it helps specifically with brain inflammation. So inside of that formula, we have certain compounds in there that can help with the brain and central nervous system, just to help it to calm down. And all of this I would recommend in the first 72 hours. After that, I would recommend a form of magnesium that can pass the blood-brain barrier and is specifically important for the brain, which is called magnesium threonate. Magnesium threonate, our formula is called Magteam, which has really, really good research coming out of MIT. This form of magnesium can pass the blood-brain barrier, which other forms really cannot, the citrate and glycinate, or not as well. But what we see that it can help to increase synapses density. And again, when we're having a concussion, we're really damaging all of that. But it's all about synaptogenesis. We want to increase those connections, get them strong again. And that's what Magteam or magnesium threonate can do. If you're not allergic to whey, there's tons of research about how whey protein can help to mitigate some of the deficits that are caused by mild traumatic brain injuries. There's also research on creatine and how creatine can help N-acetylcysteine, vitamin D. There's a ton of them. And what's nice about it is that what we can do is maybe what I can do is I can send a protocol that we already have printed out. I can send that to whomever asked that question, and then we can go ahead and send that to them. So again, I just want to give you a ballpark, some principles, some of the things that you would take a look at, but we have it written out for you that you can follow with your patients for concussions. But those are some things that I would want to take a look at.
So Maymay does take Magtine, magnesium L-threonate, it's 2 grams. And she says that it finds her brain more focused and her brain sharper. She recommends that I should take it more often, but we're not going to go down that rabbit hole. What we're going to do is I'm going to help you out with this one.
Sure.
Concussion blood marker. I believe there's a specific marker. It is. It's called NF-L because it used to be called NFL. It got a little sketchy.
Yeah.
NF-L. You can also test for blood-brain barrier proteins. That's also a great choice. And SB100 and your typical inflammatory markers that you can also do, but you're specifically talking about NF-L. By the way, one little aside, if you guys were getting towards the end, if you have any questions, throw them up because we'll do rapid fire with Asher before he leaves us because I want to be considerate of his time. I know he's got someplace to go. In the idea of concussion, you can also start testing the gut because the gut would be a preview to what happens to the brain. And we can get you back. We can go down that road right now. So I'm going to see if anybody has any, but in the interim, there you go. How can they get in touch with you?
Oh, nice. Yep. So there's my email address, so feel free to reach out to me. Also on Facebook, if you type in Asher Allen, that's one of the benefits of a unique name. You can kind of sift the names there. So Asher Allen, and then on LinkedIn. Those are the 2 ones that I use most often. And then feel free to reach out, and we can definitely take this conversation further, or we can help you with your patients with implementing a lot of these techniques that we talked about today. But again, I just want to thank you so much, and I appreciate everyone.
You can't go. You got to ask my buddy. You got to ask my buddy. You got to answer him.
Okay. It says, sounds like when the athletes lose their desire for human optimization.
Standard American diet.
Yeah. So I think Lauren is really talking about something that's really important. Lauren, there is I don't want to use the word pandemic to be insensitive, which I really don't want to, but there is a great need for help for retired athletes. They have such an extreme schedule for 20 years that when they get done, they don't know how to eat. They are used to taking 20 Tylenol. That's not uncommon. I mean, I say this now in our circles, that's weird, but 20 Tylenol before practice every day is not uncommon because I'm in so much pain because I run into a grown man for a living. I'm in so much pain, I have to take 20 leave a day. And so all of those things happen. And then like it's mentioned, the desire to be healthy really leaves because they're exhausted. They get exhausted. And be honest with you, during a professional athlete's life and a collegiate athlete's life, they're handheld, right? They're told what to eat. They're told when to do this. So the thought process is really taken out of our hands. And so when we're left on our own and that support leaves, we don't know what to do. So we still eat the same way we did when we played 6 days a week. But unfortunately, we're not at home doing that same type of exercise. And that's what leads to so much cardiovascular. That's what leads with so much cognitive issues that really can be mitigated by our diet. And that's why you see so much issues also that can be happening as well. So you're right. The desire to eat healthy is because they don't know. And Lauren, if we can in our communities help them to learn how to eat now, then we can help them when they're done with their playing careers.
So he said transitional education. That was something that I was going to jump on. Great takeaway. Good guy. One of the best functional medicine docs in New York City. Okay. I won't say the best because I don't want to get a free dinner. I'll just say one of the best. One, but really one is all by himself there. Yeah. It's all great. I agree with him. because what happens is it really shows that some of the athletes, some people gain weight, they're not exercising as much, a little age, if you will. But we see some guys, and sometimes I go, what? I mean, like actors, wait a minute. They were sinewy, and then they got corpulent. So I think some of the athletes, they never knew what to eat, and they ate the same way like they were playing 8 hours a day at 25.
There you go.
And I agree with him in transitional education. You got to say, hey, guys, the DOB is still the same. You're not exercising as much. So you mentioned pizza. Obviously, pizza's not going to be their choice. So I concur with him.
But again, that's the thing. If this education can happen earlier, how amazing this is. If you already know your genetic predispositions, you know your food sensitivities, you understand how you should be eating, how you should be exercising while you're playing, then that transitional education can be a lot more accessible and a lot more practical because you've lived it already. And it's not just dropped on you like, hey, we're done with you, boom. And now you're like, well, I'm still going to be eating how I used to eat. So it's a thing that near and dear to my heart. But if we can continue to educate, then more people can live happy and healthy lives.
Well, it looks like the flow is stopped. Everybody's going to go grab a little lunch.
Excellent.
And they're going to eat a healthy lunch based on everything you said. They're going to go back and think about the genetics. They're going to think about their supplements. And they're going to go probably in the interim, like the first thing I hear from you, like we spoke about 7:30 was, how come I'm not breathing heavy or sweating? So we're going to talk a little bit about exercise. So without any further ado, it's been my pleasure.
Oh, likewise, my friend.
Got to get you on again. Any parting shots?
You know what? Thank you all so much for joining. Thank you. And again, in your community, if you can help others to learn more about functional medicine, integrative medicine, the earlier they can learn, the more they can reach their genetic potential and live happy, healthier lives. So we're all doing our part. And so thank you for joining, and definitely look forward to seeing you all in passing.
Everybody, thanks so much. That's Asher Allen. I'm Dr. Rob Silverman. Always yours in health.
Take care.